Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
What's up, everybody? Good morning. My name is Trissa Hutchinson, Doctor of Occupational Therapy and TA within the Older Adult Division of the Modern Management of the Older Adult. Within the Institute of Clinical Excellence, I am going to dive in and talk to you guys today about urinary tract infections in the older adult and what our role as a geri-clinician is in this area. So we're going to talk about specifically four main areas for UTIs that our role as geri-clinicians has. So specifically, I want to talk to you about screening for the signs and symptoms of a urinary tract infection. We're going to talk about our role as mobility and movement specialists. We're going to talk about medication understanding, adherence and compliance, and then overall incontinence and what we can do as geri-clinicians to help address these areas. So I really wanted to talk to everybody today about urinary tract infections because if you're like me, you have worked really hard with an older adult. You have seen them progress towards their goals. Maybe they're almost even on track to meeting their goals. Maybe they're just crushing it, right? And then you go to see them or they come to see you and you find out that they were diagnosed with a UTI. They developed a UTI and it seems like they've taken huge steps backwards. Maybe they're experiencing more weakness. Maybe all of your progress towards them getting up from the chair has gone down. Maybe they're more confused and now they're more sedentary, so they feel weaker. And overall, just it's a hard hitter. A UTI overall is a hard hitter for especially our older adult population. So again, we're going to dive into screening, signs and symptoms, mobility, medications, and then incontinence. So to start off with, it's really important that we know the signs and symptoms of a urinary tract infection, specifically us as geri-clinicians. Oftentimes, we are going to be the first line of defense. So we are going to be the ones that notice even minute changes to make a referral to their provider that maybe they need a urinary analysis. So specifically, what are the signs and symptoms? A change in mental status or disorientation, an increase in disorientation can be a sure sign that someone may have a UTI on board. And we're not talking like they misplace one thing or they forget a date. We're talking about these people who are normally very cognitively sound or normally can track your conversation in a certain manner. Now are having more difficulty with that. Maybe they are dressing incorrectly, or I've worked with someone who I showed up and normally she's extremely put together, very prim and proper, and she was wearing a vest over a vest backwards. And so it was a sure sign something is going on here, especially because she had no idea that she had done that. So a change in mental status. Another sign and symptom, it can be an individual experiencing pain in the suprapubic area or tenderness in that area. It can be increased burning sensation. So they're telling you like it kind of like burns down here or it's kind of itchy. Maybe they're going to the bathroom more frequently or they're telling you like, oh, I was up so many times last night or I've gone to the bathroom all day today. And so make sure that when people say things like that to you, ask, are you drinking more water? Do you feel like you're going a lot more than normal? So again, signs and symptoms can be increased urination frequency, burning, itching, all of those things. If you are someone that takes individuals to the bathroom in your session, you may notice a change in their urine. So specifically, maybe this is like a cloudiness, a discoloration slightly, maybe even an odor or a different smell in their urine. And it's pretty potent if you've ever experienced that. So if there is a big change, make sure that you are noticing that and not just disregarding that. Make sure that you are noting and talking to a provider. And then people who are a little more advanced, in their urinary tract infection, or maybe they've had this for a few days and now you're going to see them, they may even be starting to tell you that they have a fever or feel like they have the chills or something like that. And you could screen for a fever that way too. So knowing the signs and symptoms, super important. Us as geri-clinicians have a big role in playing in noticing these things, getting on the phone, calling the provider, calling the nurse, asking them if they would see their patient about potentially having a urinary analysis to get treatment on board very quickly. Okay, signs and symptoms. Now that we know them, let's go on to mobility. So us as geri-clinicians, we are movement specialists. We know how to scale movement. We know how to help people with their strength and overall movement. So one thing that I really appreciated when I was diving into the research regarding our role in urinary tract infections was Rowe and Wanitha Mehta in 2014 shared that older adults that are over the age of 65 had a 69% reduction in the risk of hospitalization from a UTI simply because they could walk independently and did not depend on someone else to help them get to the bathroom. They had a 69% reduction risk of hospitalization simply because they could walk. So that tells us that us as geri-clinicians, when we are helping our people get stronger and walk more independently and get to the bathroom, that we are already doing something to help prevent the further risk of a urinary tract infection. So that's pretty cool. That was a hard hitter for me. I thought that was pretty valid information and kind of validates what we're doing and the importance of how we help our older adults. However, this means that we don't ignore the people who can't get to the bathroom by themselves. We need to make sure that we are doing things to help those individuals as well. So maybe we need to talk to our older adults about the pathway to get to their bathroom. So if we do have a wheelchair user, maybe we need to talk about environmental changes or different adaptive equipment to get them to the bathroom more independently and more quickly so that they do not have to rely on someone else. In regards to mobility, we're not just talking about walking and getting ourselves to the bathroom. However, we're also including overall range of motion. So how do we look at range of motion when we're going to the bathroom? Well, can our older adults physically clean themselves? Okay. Think about this. It takes a lot of shoulder range of motion to wipe your own bottom. Okay. So if your older adult can't reach behind their back and can't completely clean themselves, then they're at a higher risk of developing a UTI because they're harboring bacteria and fecal matter when they need to clean their perineal area. Okay, so maybe we need to talk about different ideas such as using wet wipes so they're more likely to get clean with fewer strokes of wiping. Maybe we need to go as far as suggesting that they get a bidet so that they can clean without having struggles with their range of motion in general right off the bat. So again, I encourage you guys, look at their mobility, not just getting to the bathroom, but also overall range of motion and cleaning themselves in the bathroom. So we know the signs and symptoms, we can screen for them and we can refer. We're movement specialists in both getting to the bathroom independently or as independently as possible, as well as range of motion for cleaning and hygiene in that direction. Then I want to talk about medications and antibiotic adherence and overall compliance. So one thing that I was reading in the research is, there's not a ton specifically on when we talk about like wiping front to back or all of those things when we talk about interventions for really getting rid of a urinary tract infection. All of the research was really driven around specific antibiotics to help these individuals. And so we know that they can be very effective and they can take care of a UTI very quickly. However, if our older adult does not understand how to take their medications appropriately because maybe they're experiencing one of the signs and symptoms of a UTI, which is increased disorientation and confusion, then these medications are not going to help them if they're not taken appropriately. I was recently working with an older adult who had a urinary tract infection, and I walked in, and this was Thursday, and she was supposed to take her medications 3 times a day. First of all, she had a bunch of pills in these small cups on the counter, but she didn't know when to take them. I asked her what day it was, and she told me it was Sunday and asked me who had won the Super Bowl on Thursday evening. So what we did was we got her one of those clocks that says the day, date, and time of day. So specifically, this clock would read Thursday evening. And so we set up a chart for her and set everything up on her counter so that it was very simple to look at. And it read Thursday evening, Friday morning, Friday noon, that type of thing, so that she could very easily look at the clock, understand what day it was, and then take the correct medications on time. So a simple change in setup and environment and making that extra step or taking that extra step really helped her with managing this urinary tract infection more effectively, efficiently, and we got rid of it much more quickly. So again, making sure that older adults are understanding their medications, not just thinking like, oh, they have a medication, it's not my problem anymore. Okay, we have a role in helping these individuals. Okay, so starting from the top, knowing our signs and symptoms and screening for them, referring appropriately, checking out mobility, not only getting to the bathroom, but also range of motion so that people can be clean and complete hygiene tasks. And then making sure that we're checking medication understanding and compliance and doing what we can if we need to change setup. Lastly, I want to talk about addressing incontinence with the older adult. So if you've hung around the modern management of the older adult crew, you know that as Geri-Clinicians, we are all pelvic floor therapists. We are all pelvic floor therapists. Oftentimes our older adults will experience changes and have difficulties with incontinence. And so we need to address this topic. We need to open the door. We need to have the conversation. We have a role and we can make simple changes and recommendations that go a long way with older adults in terms of incontinence. We know that if people are having incontinence, again, first, maybe they're struggling with functional incontinence, so it's not getting to the bathroom, so we're addressing their mobility. Maybe people are having troubles with urge incontinence and they are not able to fully empty their bladder. And so the residual urine in their bladder is harboring bacteria and putting them at a higher risk of developing a urinary tract infection. And so we can do things and make simple changes and recommendations to help with emptying bladder, with reducing urge incontinence. The same goes for stress incontinence. We can address these different challenges. We can help with building strength. We can provide simple, straightforward recommendations that can make a really big change, not only in someone's incontinence, but subsequently, then we can make a change in the reducing the risk of someone's overall urinary tract infection rate. So we have a role in helping individuals with urinary tract infections. We can make a difference. It's not just something that we refer to a clinician or we refer to a medical provider or medical doctor and then we let it go. We have a role. We can know the signs and symptoms. We can screen for all of these and we can refer appropriately. Then we can address mobility, specifically getting to the bathroom, and then also what an individual can do in the bathroom. We then can check their medications and their administration on overall understanding and adherence and compliance and make sure that they are taking their medications and antibiotics appropriately as prescribed by their doctor. And then we can address their incontinence overall and make sure that we are providing recommendations to help our individuals in the long term. So thank you everybody for listening. And I hope you took some takeaways away for helping our older adults with their urinary tract infection and reducing their risk of getting one. With the older adult division, we have lots coming up for the following year. Live courses next weekend, we will be in Madison, Wisconsin. April 6th and 7th, we'll be in Urbana, Illinois. And then we've got level 1 and level 2 starting in the middle of May. So if you guys are looking to grab a seat, learn some more about how you can change the lives of older adults in a very fitness forward, evidence-based, effective, and efficient manner. I would love to see you guys there, and I hope you all have an awesome week. Take care, guys.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.